We good? Okay, thank you.
Okay, good evening, everyone. We will call to order the meeting of DuPage County Health Department for April 8th, 2001. Before we begin, we'll read some language that is important to us based on the governor's executive order. Pursuant to Executive Order 2020-07, 2019 IL EO 20-07 issued March 16, 2020 during the duration of the COVID-19 gubernatorial disaster proclamation. The provisions of the Open Meetings Act 5 ILCS 120 requiring or relating to in-person attendance by members of the public body are suspended. Specifically, the conditions in 5 ILCS 120/7 limiting when remote participation is permitted are suspended. The DuPage County Health Department is the lead agency for DuPage County in response to the global pandemic, and as such is currently closed to the public except by appointment in adherence to public health guidelines and for the protection and safety of the public and staff. Tonight's meeting is being conducted remotely and being live streamed for the public's viewing on the agency's YouTube channel, which can be accessed at the live stream link on the health department's website. Members of the public have the opportunity to submit written comments in advance of the meeting. The method for public participation is publicized on the health department's website. Public comments will be read and recorded in compliance with the Open Meetings Act. So I am calling the meeting of the DuPage County Board of Health to order. A physical quorum of the members is not present. However, pursuant to Section 7E of the Open Meetings Act, members are permitted to attend remotely. Either one member of the committee, the chief administrative officer, or our chief legal counsel are physically present at the regular location. In-person attendance and public comments are allowed, subject to attendance limitation required to ensure the health and safety of those who attend. That being said, welcome again. Penny, I would ask you to call the roll, please.
Ms. Bottoms? Here. Ms. Finch?
Here.
Dr. Hussein? Oops. I am sorry. Ms. Garcia?
Here.
Ms. Geider?
Here.
Dr. Hussein? I believe I saw
Here.
him.
Yes.
There he is. Okay. Dr. Munir? I don't believe she's on. Dr. Scouten?
Here.
Mr. Spadoni?
Here.
President Tornatore?
Here.
Dr. Weeks?
Here.
Dr. Wilson?
Here.
Mr. President, you have a quorum.
Thank you. Welcome again, everyone. Moving on to the agenda, we'll go to the portion of the agenda known as public comment. Based on the bylaws that we passed, of course, last month. The public comment time provision is for 30 minutes, 3 minutes per person. It's my understanding we have no one here in person. We do have some that have been sent in online. Penny has those based on our policy and advice of our counsel. She will be reading them in the order in which they were received. When we get to 30 minutes, unless there's a motion to extend the time, we will cut off public comment, and anyone's public comment that has not been read, their names will be entered into the minutes as having participated. Penny, it's yours. It's 20 after 6. You have a half hour.
Nicole Coletta, Elmhurst, why are we still recommending that children be masked, especially when they are outside? We know the following to be true. Children are not drivers of COVID transmission. Thus, regardless of mask policy, we would expect to see limited transmission in schools and from children to adults. COVID is less dangerous to children than seasonal flu, not to mention other everyday risks we accept as a normal part of a child's life. 3, masks are at best credibly disputed as a virus mitigation measure by decades of quality research, as well as observed results of mask mandates around the world, and at worst, possibly dangerous. Without overwhelming evidence, not lab studies that suggest mechanistic plausibility, while real-life results around the world prove otherwise, but real-world evidence that masking children leads to long-term positive holistic health outcomes for a range of health issues and doesn't actually harm our children, we must abandon this misguided attempt to singularly control a flu-like virus through experimental interventions and suspension of individual liberties. Children have suffered enough. They have paid a steep price for our fear, bearing a burden that was not only unwarranted, but also, as locations around the world have shown us, completely unnecessary. It is our job to protect our children, not the other way around. Comment, Jean Hogan, Elmhurst. I am asking DCBH to petition IDPH on behalf of our children. Masking children outside should be optional and parental choice, especially when the kids are playing high cardio sports. As of April 19th, there will be a vaccine available for everyone who wants one over the age of 16. Athletes did not have to wear masks in the fall when Illinois was in the same phase as we are now. Children wearing masks while exercising outside in the heat is dangerous, and it is not in the best interests of their well-being. As shown time and time again, children are not at risk for serious illness or death from COVID. The seasonal flu is greater risk to children, and we have never masked them for the flu. The kids would only be wearing masks to seemingly protect adults who have access to vaccine. Hospitalizations and deaths are at a rock bottom numbers on the DuPage COVID tracker. There is no need to mask children outside during exercise. The World Health Organization does not recommend masking during exercise, even when you're in an area of COVID-19 transmission. Masks should not be worn during vigorous physical activity because of the risk of reducing your breathing capacity. Wearing a mask is harmful. Masks collect microbes so well that they function as personal bioaerosol samplers, increasing our risk of infection, reducing our oxygen levels, increasing our carbon dioxide levels with numerous serious consequences, suppressing the immune system, causing an acidic environment in the body, causing us to inhale nanofibers from the mask, causing headaches, and reducing performance. Exercising with a mask may be particularly harmful. Thank you. Comment, Amy Wellman, Elmhurst. I'm concerned why the DuPage County Health Department is requiring masks on healthy children when they are outside playing sports or practicing attending camps this summer. Every 16 age plus person will have the ability to be vaccinated by the time these summer activities commence. Why are you requiring healthy children playing outside to wear masks? These vaccines, which we are so fortunate to have, are very effective in preventing hospitalizations and deaths against COVID-19 and its variants. What is the DuPage County Health Department waiting for to make masks optional on children playing outside? Some points to consider. One, at the present time, the widespread use of masks by healthy people in the community setting is not yet supported by high quality or direct scientific evidence, and there are potential benefits and harms to consider. The World Health Organization 21621. Two, to deprive a child or adolescent's brain from oxygen or to restrict it in any way is not only dangerous to their health, it is absolutely criminal. Oxygen deficiency inhibits the development of the brain, and the damage that has taken place as a result cannot be reversed. This is by Dr. Margaret Greason-Brishin, MD, PhD, world-renowned neurologist. Number three, mask mandates are not supported by the scientific data. There is no scientific evidence that mask mandates work to slow the spread of disease. J. Bhattacharya, MD, professor of medicine, Stanford University. Number four, in 2020 alone, six systematic reviews with meta-analysis, the highest form of scientific evidence of randomized controlled trials, have shown that masks don't stop the spread of respiratory viruses. If masks were even moderately effective at reducing the risk of infection, the benefit would have been statistically detected in these high-quality previous large studies. Five, surgeons wear masks to protect against droplets, splashes, and sprays, not respiratory aerosols. If they're sick, they do not perform surgery. They also have additional oxygen piped into the operating room to counteract the lower oxygen behind the mask. Six, although outdoor transmission is acknowledged as being theoretically possible, there is no concrete evidence. The preponderance of the evidence says that you are highly unlikely to contract the coronavirus outside because of air currents and infinite dilution of the viral particles. Among the millions of confirmed cases, there's no real evidence of outdoor transmission, just fear. Wearing masks outside under normal circumstances is particularly unjustified. Comment, Liz Hayward, Elmhurst. Please consider making the masks of young children optional after a year of compliance, other mitigation efforts, and now widely available vaccines. The mandatory masking of children should be reconsidered. Masking of young children is not without risk. Delayed progression of speech skills and psychological effects are some of the negative consequences that have been reported in research on this topic and that I have personally witnessed. It is time that parents are given a choice when to mask their own children, particularly when outdoors participating in activities this summer. Thank you. Comment, Heather Smirosky, Elmhurst. Please update your guidance on mask wearing immediately. Children do not need to wear masks. It is cruel to make them wear masks while sitting at their desk at school all day. It is dangerous to make them wear masks while playing sports outside. Requiring children to wear masks while playing sports outside is against the World Health Organization guidance. The Elmhurst Park District is requiring children to wear masks this summer while outdoors at camps and while playing sports. College and professional athletes are allowed to play sports without a mask, but little kids in Elmhurst need to wear a mask. The Elmhurst Park District is requiring children to wear a mask because of your guidance. It is time for the DuPage County Health Department to use common sense and make decisions that are in the best interest of children. Comment, Summer Roberts. Why are we continuing to perpetuate the need for masking of children, especially when they are outdoors? There is research upon research studies that have been done that prove children are not drivers of COVID transmission. In fact, the World Health Organization recommends not masking when involved in physical activity. Research that the World Health Organization states they do not recommend masking during exercise, even when you are in an area of COVID transmission. 2, masks should not be worn during vigorous physical activity because of the risk of reducing your breathing capacity. 3, at the present time, the widespread use of masks by healthy people in our community setting is not yet supported by high quality or direct scientific evidence, and there are potential benefits and harms to consider. This is from the World Health Organization on 2/16/21. Can you please supply your data, research, and evidence of why children need to be continually masked outdoors, not just fear-based recommendation? Here are a dozen of states of kids participating in activities indoors and outdoors with no mask, and there has been no widespread transmission. Although outdoor transmission is acknowledged as being theoretically possible, there are no concrete evidence. The preponderance of the evidence says that you are highly unlikely to contract COVID-19 while outside because of the air currents and infinite dilution of the viral particles. Among the millions of confirmed cases, there's just no real evidence of outdoor transmission, just fear. Children have suffered long enough and have bared the brunt of these overzealous and unfounded mask requirements. They have been forced to carry the burden of protecting adults in our community when they are not the drivers of COVID. COVID is even less dangerous to our children than the seasonal flu. Our hospitals are not overwhelmed and vaccines are now readily available to people 16 and older. There's absolutely no need to ask our children to be masked while outdoors, especially when it is found to be even more harmful to their health. Please change these recommendations so our local park districts are able to give parents the choice of masking their children, particularly when outside. You are harming our children with these recommendations, not protecting them. Comment, Rebecca Harpster, Elmhurst, dear DuPage County Board of Health. I am writing to request that the DuPage County Health Department better track quarantines at the county level. You should be tracking school quarantines and whether they turn into isolations or turn symptomatic so that we can see if the policies we put into place to prevent spread of COVID-19 are effective. And after tracking data, if you find the mitigations effective, you should be advocating to reduce the quarantines of masked close contacts in the school setting. Thousands of healthy children are missing in-person school in the DuPage County because of your quarantine restrictions. Please be a leader in this regard and track this data so that our scientific theory can turn into actual data that can be used to make decisions that are in the best interest of our children. Thank you. Comment, Rachel Lenoble, Elmhurst. It's beyond time that DuPage and the Illinois Department step out from J.B. Pritzker's politically fueled motives and start putting science and our children first. Private schools and public systems all over the country, have demonstrated how safe and low-risk schools and children activities are, and yet we blindly follow these overly conservative policies so that parties can push political agendas. It's sickening to witness how many people are fleeing this corrupt state that will only continue to spiral down the financial gutter because as parents, they draw the line where they should their child's well-being. Most people from this area have put up with Illinois backward ways and corruptions to be by family. Now that you and other public entities in this state are taking part in family suffering, people have had enough. As a health institution, it's about time you put our most vulnerable demographic first. No more ridiculous quarantines of healthy children and remote learning options. Suicide rates and depression are skyrocketing. What are you doing about that? I beg you as parents, grandparents, family members to consider the harm that you are doing to this generation and start prioritizing the future of this world. Children need consistency and normalcy to grow and thrive. We have let them carry the burden of this pandemic for well over a year. It's about time we start acting like the adults we should be and prove to them it wasn't for nothing. Children's lives should have been the first to return to normal, not simultaneously with ours. Prove to the people who haven't fled to open states we're holding out hope for a reason. Comment, Heidi Baird, Elmhurst. Your recommendations to have our children wear masks outdoors during sports activities seems counterintuitive for many reasons. Firstly, COVID has been shown to very rarely, if at all, spread outdoors. Secondly, children are not spreaders of this disease. Thirdly, cases are dropping everywhere. And most importantly, hospitalizations and deaths have significantly decreased. And lastly, almost all vulnerable people have been vaccinated with the last couple months, and everyone who wants a vaccine will be able to get one beginning next week. The vaccines last at least 6 months, which is through the end of September. To force these kids to wear masks when outside around each other during strenuous exercise over the spring and hot summers months is ridiculous. Can someone with some common sense please overturn this edict? Our kids have been through enough this past year and continue to treat healthy children as bearers of a deadly disease, and making them wear masks when they are little to no risk when outdoors around vaccinated adults seems to be an extreme reaction. This cannot go on forever. People who want to wear masks can do so. They can wear 2 masks and a 95 mask. They can get vaccinated. They can sit 6 to 20 feet apart from the sporting event, etc. It's time for this madness to end. Comment, Rachel Reiger, Lombard. The mandate of masks and quarantine have to go after the vaccine becomes available to all. With all the government control, this is becoming one of the worst places to live. Traveling to other states post-vaccination, as I have been doing, you see what other states are doing, and coming back here to DuPage feels like a different country. The social emotional child development that is taking place before age 12 is crucial, and covering up their faces and forcing them to distance was what we needed to do for a while. But when the vaccine is available to all, we cannot continue to let the most powerless children in our society bear the burden of the ones who choose not to be vaccinated. I have 5 kids under the age of 12. We will not stay here if DuPage County does not show leadership as it has in the past and make the brave and tough decisions that make the most sense for our community moving forward. We do not need to follow the corruption of the state and Chicago. Comment, Wendy Ronk, Elmhurst. Why is it that the school system and pediatricians follow different guidelines regarding returning to school after an exposure or symptoms regarding testing? My pediatrician follows the CDC guidelines. My daughters have had to be tested before they had one symptom, a headache that is not on the CDC symptom list. Now we have COVID in our home. 3/4 have tested positive despite being vaccinated and following distancing guidelines. My 9-year-old is negative. Our trusted pediatrician says 5 days after the last person is released, my daughter can test, and if negative, return to school day 7. However, the school will mandate her to quarantine another 14 days, regardless of the negative PCR test. Why can't everyone be on the same page? Pediatricians treat our children in medical conditions. We trust them with the lives of our children, but schools follow the Department of Public Health over what the CDC and board certified pediatricians follow. Why? Comment, Megan Howrigon, Elmhurst. Masking children has become dehumanizing. Masks should be optional for all children. We are taking away their right to breathe air. Our children have suffered for a year protecting adults, and now that adults are vaccinated, it's time to let our children live and breathe air. We make masks optional please make masks optional for sports and school. Comment, Carrie Armstrong, Elmhurst. Please make masks optional at school and for our outdoor camps and sports. These kids are overheating wearing these masks in this hot weather. My son experienced heat stroke at an outdoor soccer practice yesterday, and my 8-year-old came out of school with a soaked face mask, soaked with sweat from outdoor recess. These schools are old and are also extremely hot inside too. I'm afraid of bacterial pneumonia. Everyone who has chosen to be vaccinated has had the opportunity to do so. It is now time to move forward. Masks should be optional per each parent. Many of us believe they are detrimental to our children's health. As parents, we should be allowed to choose what is best for our children's health. Thank you. Comment, Cecilia Grebs, Elmhurst. Please change your recommendations for masking healthy children, especially outside. All adults will have access to the vaccine starting April 19th, 2021. Children are extremely low risk for COVID and should not need to be masked once all adults have access to the vaccine. The negative impacts to masking children outweigh any COVID risks. Many children do not want to participate in school or sports if masked. They miss out on so much social, emotional learning when masked. Please start putting kids first. Comment, Carrie Kepner, Elmhurst. I do not support quarantining healthy kids. My family has had to quarantine due to positive close contact from classmates. On both occasions, my children tested negative and were forced to remote learn for 10 to 14 days, respectively. Different times, different quarantine rules. Our children are masked at school, use hand sanitizer, sit 3 to 6 feet away from others. Students are doing everything to remain safe and follow the rules. Where is the collected data to capture forced quarantines due to the close contact? The public is owed these statistics. If children are not turning positive or percentages are low, the risk is low. The children belong in school learning, no more close contact quarantines. The rule guideline needs to be reevaluated. It's causing mental health issues for children as well. Soon, high-risk people and adults will be vaccinated should they choose to do so. The time has come to keep our children in school, regardless of what happens to the peers sitting next to them. Pediatricians agree. The rule guideline regarding quarantining a sibling from school for non-COVID related illness also needs to be reevaluated. My children have been forced to quarantine when their sibling was ill. Again, unacceptable. Why we don't quarantine for flu, do we? Or for in close contact, we monitor for symptoms and keep only the sick children home. It's time to move forward. Comment, Kristen Milani, Naperville. When will we stop abusing our children? Masks during strenuous exercise and sports, especially outside, is not safe. I worry for my asthmatic daughter and all of the other athletes who are being forced to mask their face to play the sports they love. Enough is enough. Masks should not be required while playing sports. Additionally, healthy kids with 0 symptoms of COVID should not be forced to quarantine. This has gone on long enough, and kids recover from COVID at an extremely high rate. Let them be kids and enjoy what is left of their childhoods. Enough with the quarantine the healthy. Comment, Carolyn Heflin, Elmhurst. I would like to ask why you continue to require masking of children, especially outdoors. We know the following to be true. 1, children are drivers of COVID transmission. Thus, regardless of the mask policy, we would expect to see limited transmission in schools and from children to adults. 2, COVID is less dangerous to children than seasonal flu, not to mention that everyday risk we accept as a normal part of child's life. 3, the World Health Organization does not recommend masking during exercise. Even if you're in an area of COVID-19 transmission, masks should not be worn during vigorous physical activity because of the risk of reducing your breathing capacity. 4, wearing a mask is harmful. Masks collect microbes so well that they function as personal bioaerosol samplers, increasing our risk of infection, reducing our oxygen levels, increasing our carbon dioxide levels with numerous serious consequences, suppressing the immune system, causing an acidic environment in the body, causing us to inhale nanofibers from the mask, causing headaches and reducing performance. Exercising with a mask may be particularly harmful. 5, to deprive a child's or adolescent's brain from oxygen or to restrict it in any way is not only dangerous to their health, it is absolutely criminal. Oxygen deficiency inhibits the development of the brain, and the damage that has taken place as a result and cannot be reversed by Dr. Margaret Brisson, MD, PhD, world-renowned neurologist. Children should not be wearing masks, especially when exercising and playing outdoors where they need more oxygen and are at a much lower risk. Please put children first. Comment. Gracia Levy, Naperville. Hi, I'd like to comment on young children being required to mask at preschool and schools. Who is ensuring the masks are being washed regularly? There are plenty of families who do not have a washer or dryer at home. There are still children on District 203 buses who are sleeping and not being monitored with masks on, slouched in a bus car seats. DuPage County doesn't find any risk of this. When the CDC clearly states masks should not be worn at daycare, why are they sleeping with them on a district preschool bus? Who is ensuring that masks get changed when the children touch them during their toileting time? Please imagine young children who are not potty trained like my daughter, who also have sensory issues and constantly touch their mask, and then they are learning to wipe their bottom and touching their mask before they can wash their hands. When young children are not wearing them properly, isn't any effectiveness then taken away, and we are left with a communication blocker and a hindrance to speech and language acquisition. My child sucks her mask and it comes home drooling wet. This is both ineffective as a COVID blocker and also gross for her, just breeding germs along her face. Why is this not being discussed? Why are children having to wear masks outside at recess? What confirmed transmission has occurred outdoors in DuPage County? The mass theater at the cost of kids. My 5-year-old child with cerebral palsy has a severe language impairment. She is not exempt from wearing a mask and is a great deterrent to her. If her teachers are all vaccinated, how long are we going to continue to make her struggle with communication and being understood indefinitely? Thank you. Comment, Adam Russo. While I'd like masks to be a choice for adults, I'm not going to fight that battle. Instead, let's get them off kids, especially while they're playing sports. I know you all know they need to be removed from kids while they are active, but don't have the spine to say it. Be leaders and start getting the masks off kids while involved in athletics or other activities where they are exerting energy. Thank you. Comments, Jennifer Springer, Naperville. It is ridiculous and unsafe that athletes at all ages and levels are playing outdoors with masks. The masks become soaked with sweat and they literally cannot breathe in some cases. In the fall, my high school cross-country runners were not required to wear masks while running, and now it is required for all athletes. What changed? Please reconsider this rule ASAP. Comment, Emily McBroom. I absolutely disagree with children wearing masks outdoors while engaging in sports. I have 3 boys involved in varsity of sports who are finding it very difficult to breathe while running and engaging in their outdoor activities. Masks must come off. Comment, Deb O'Connor, Elmhurst, dear DuPage County Board of Health. My school district, Elmhurst District 205, follows your guidance rather than the CDC's regarding quarantines. This is resulting in many children being quarantined for 2 weeks, regardless of whether or not these children have symptoms during that time period. Data suggests that children are not transmitting COVID during school and that children are not experiencing severe symptoms of COVID. However, data also indicates that children are experiencing severe mental health issues due to quarantines, separation from their peers, lower self-esteem due to the educational impact of learning through a video screen, and the inability to participate in activities. Even the anxiety related to kids worrying about getting quarantined for close contact such that they cannot go to school or will have to miss out on an activity is having a daily impact on children from preschool to 12th grade. Please change your quarantine recommendations for children from preschool through 12th grade. Put the kids first. At the very least, please begin tracking school close contact quarantines and requiring schools to track close contact quarantines to see if these remain necessary. Please, at the onset of this tracking, indicate a reasonable number that must be met in order to continue these quarantine measures. If the impact of these quarantines cannot continue to be ignored. Please minimize these quarantine requirements now and set a clear standard. What data must indicate in order for close contact quarantines to be eliminated as soon as possible? Thank you for your work and your time. Comment, Katie Gable, Glen Ellen, please, please, please consider mask-free outdoor sports for children. There's no data showing that COVID is spread outside, and I would love to see the science of the safety of masking young children as they run around with masks covering their faces. I refuse to sign my 4-year-old son up for sports that require him to wear a mask. Comment, Laura Youngren, Elmhurst, I am running to encourage examining the data regarding forced quarantine for close contacts, particularly in schools. Our students have many layers of mitigation, including social distancing, masks, and frequent hand washing. I would like to see the data that indicates that students who are masked and at least 3 feet apart result in additional positive COVID cases. Are the quarantines of these close contacts helping reduce the spread of COVID, meaning that these close contacts have received positive results, or are we needlessly quarantining our students? Comment, Susan Saponero, Naperville, wearing masks when playing outdoor sports does nothing but hinder breathing fresh air. Comment, Emily Margasonian, Naperville, I'm concerned about my child having to wear a mask for over 6 hours a day. I also don't think it is safe to wear a mask while playing outside and doing rigorous sports or PE. Comment, Stephanie Remelis, Glen Ellen, please consider allowing kids to play sports, outside sports with no mask. Thank you. Comment, Joni McMillan, review the outdoor mask mandate, especially in sports. It's not safe and the kids are suffering from this mandate. Comment, Mary Rybicki, Glen Ellen, please consider dropping the mask requirements for children participating in outdoor recreational sports such as tennis, soccer, lacrosse, baseball. Research has shown that COVID molecules basically disappear in the fresh air and sunlight. Children are already low risk for COVID. They have to wear masks all day at school. Let them play a sport without decreasing their ability to breathe fresh air and get them back to some normalcy. Comment, Kristen Drapinski, Glen Ellen, requesting that children not be required to wear masks during outdoor recreational activities. Ideally, indoor activities in schools should be made optional as well. Children have been shown not to be spreaders of COVID and have low infection rates. However, mask wearing is proving to be detrimental to their physical and mental health. It should be a parent's decision, not government. Comment, Catherine Platt, Elmhurst, I'm very much opposed to masks, and especially for all school-age children. Whatever happened to 2-week quarantine over a year ago? Enough is enough. Be done. You're killing our poor children and grandchildren with mental health issues. All these poor babies born are looking at blank faces. Masks don't stop the virus. It's not COVID-19 that's killing us. It's all the ridiculous restrictions. Comment, Jill Cesaroni. We feel that kids playing sports in masks need to stop. They are outside and the kids aren't a huge risk. That is proven time after time. Please remove the required mask for outdoor sports. With summer coming and warm temperatures, some of these kids are on baseball fields for over 3 hours, and heat stroke from wearing a mask for that amount of time should be more of a concern. When kids wear masks, they drink less water. It's just this. It is. We need to get rid of the mask mandate. These kids need to play sports without mask. It is time. Make it time. Jamie Hickman, I do not like that children are being mandated to wear masks while outdoors for any reason. I believe it is more of a health risk to their ability to breathe than the risk of COVID. Comment, Liz Hastings, Naperville, now that vaccination is available to all elderly, teachers, and soon-to-be adults, please reconsider removing outside mask mandates for children and reducing quarantine restrictions regarding COVID exposure for school children. Graphs comparing states with mask mandates and those that have lifted them do not reveal evidence that masking is scientifically beneficial. Texas and Mississippi have seen a decline in case counts while lifting their mask mandates 1 month ago. Source Newsweek. It's time for children to get back to being children, socializing and breathing in more normal ways. Enough damage needs to be repaired for them as it is. Now that adults can choose to protect themselves and COVID is less dangerous to kids than the common flu, it is time to give them their childhood back. And are we okay on time so far?
I
Yes,
think
we
we got
have,
about 5 minutes left.
Okay. Comment, Trish Fisher, Elmhurst, please reconsider your guidance on masking on children, particularly outside this summer for camp. Masks clearly become wet in warmer temperatures from sweat, making them useless. Children need this summer to interact and work on social skills they've lost this past year. Masks very much inhibit this, as well as speech in younger children in many countries and even other United States. It is not recommended or required to make young children, yet our policy in Illinois is particularly draconian. Let's give our children the freedom to breathe fresh air, since there is no evidence of the outside spread of COVID, limited evidence of children spreading COVID, and by the summer, any adult who wants the vaccine will be able to get it. Comment, Leona Borema Lombard, if the desire is that all adults get vaccinated, why not attach it to the mask mandate? Make mask wearing optional for vaccinated people. As of now, there is no incentive for getting vaccine. Get your vaccine and keep wearing a mask. What good is that? if I am 98% safe from getting or giving COVID after vaccine, I no longer need to mask up. Then you will have most of the population getting the vaccine. They will understand how effective it is. Comment, Elizabeth Thompson, Elmhurst. I'm writing in regards to 2 issues. 1, quarantine guidelines. I asked that the DuPage County Health Board to review and revise quarantine guidelines for school and sporting events for children. Children who are healthy should not continue to have their lives disrupted. Keeping the definition of a close contact at 6 feet apart is arbitrary, overly restrictive, and is leading to major over-quarantine practices. This statement is supported by the Ohio State Health Department study known as OSCE, which showed under 1% of school quarantine cases actually turned into cases of isolation. Sporting events, especially those conducted outdoors, have not been shown to be a source of significant spread among youth. Studies from Wisconsin and older athletes show this data. The children are also at lowest risk for contracting COVID-19, and adults have been given the chance to be vaccinated. These guidelines are no longer support any prevention strategy for COVID-19, have not been proven as necessary, and are posing greater risks than benefits. It is time that the health department stops making children the exception to shortening quarantine. They have the lowest risk for severe disease, lowest risk of spread, yet they have a lot to lose. Stop imposing the strictest and most disruptive guidelines on children. 2, masking for many of the same reasons as above. The health department needs to review and revise the guidelines for masking. Outdoor spread of COVID-19 is rarely documented in regards to youth. Our children are suffering from normal peer interactions, missing out on the communication and social cues. The masks hide without defined benefit to outdoor masking recommendations. We know a lot more about COVID-19 now, and the guidelines put forth by our local health department needs to better reflect the science we have. Our schools, park districts, and camps depend on this. Our children desperately need to be valued, and decisions made on their behalf needs to consider all the negative impacts these restrictions impose. Comment, Stephanie Siska, Naperville, to whom it may concern. I would like your team to revisit the outdoor sport mask requirement. As the weather gets warmer and more humid, it's dangerous for kids and adults to be exerting themselves in masks outside when the risk of viral spread outdoors is known to be minimal. The intention of masks was to add an element of protection indoors where spacing was a challenge, and it has morphed into masks everywhere regardless of space. The abundance of caution has potential for harm. Meanwhile, cases are dropping in states that have dropped their mask mandates. The vaccine is available and widely administered, and there are treatments. Thank you. Comment, Carol Davis, Carol Stream. The overbearing rules, they are not laws regarding wearing masks, must stop. There's a great deal of contradictory information regarding the effectiveness of masking. They can cause many problems. Children, especially when they are active, such as playing sports, can definitely be harmed by having their breathing restricted by a mask. The heavy-handed control of children while they're playing sports and making them wear masks must end. Shall I continue?
Peggy, you got time for one more if it's 3
Okay.
minutes or less.
Okay. Comment, Lori Norse, Elmhurst. I would like to voice my concern of requiring children wearing masks outdoors during physical activities or learning programs. I absolutely do not support children wearing masks outdoors. Outdoors is the only break children can have without masks, and currently the only way for children to socialize as before and engage more visually intimately. Research has proven your requirement is unnecessary to maintain healthy. Research has shown that our children's emotional needs trump mask wearing in most environments and especially outdoors. Please do not force any unnecessary mask ordinance when children are outside during organized activities. Moving forward, thank you. And I believe that would be it then, Sam.
Penny, how many more people do we have whose public comments have not been read?
You have approximately a dozen.
Okay, can you just read those names as people who have submitted public comments? And we'll enter their names into the record as people who have participated.
Yes, and they are very similar in style to all those previously read. One was from Helen Vidagiani, one was from Jennifer Sommer, one was from Cheryl Koenig, one was from Christine Evans, Beth Novak, Michelle Saltiel, Laura Youngren, Evelyn Boutine, Angela Schoberl, Kelly Ridges, Erica Fine, Shannon Gainey, T. Lowe, Laura Miller, and Michelle Kaminsky. And that concludes the public comments.
Thank you, Penny. That does conclude the public comment portion of the meeting. Our bylaws and our policy do not provide for generally responses to those. However, we do appreciate all the people who took the time to send in their thoughts to us, and we are listening. Under my president's remarks, I'd like to again welcome you to this meeting. It's a little bit different. Karen and I and our state's attorney, as well as our IT people and Penny, are here. We did this so that there could be an opportunity for people who wanted to come in person would be able to come. And of course, for safety reasons, given the spike over the past month, we moved from trying to get all of us in the same place to continuing on Zoom. Clearly, our plans did change because of that increased activity. We're going to continue to provide an in-person option for residents to bring their public comments before us. And we certainly appreciate the work of the state's attorney's office and making sure that we're complying with all of the laws and rules and regulations, as well as our IT department, to bring us to this evening's meeting. This week marks American Public Health Association's National Public Health Week. This year's theme is National Public Health Week 2021, Building Bridges to Better Health. Certainly something that we believe and embrace both before and after the pandemic. We do have a lot to celebrate for here in DuPage County, locally and around the globe as well. We do build bridges in partnership, notwithstanding some of our public comment, and we do look forward to celebrating with our staff in the next month. Couple of things that I know that I have been approached over the last month. People have read in the newspaper and taken with great pride that DuPage County was deemed once again the healthiest county in the state of Illinois. And that's something that all of us should take great pride in. And also that we have vaccinated more people over 65 years of age than anyone in the state, with the exception of Kendall County. And we know that there are only 4 people in Kendall County over 65. So that means that we're doing a really good job. I kid Kendall County. That concludes my remarks. I will turn it over to Karen for our COVID-19 response activities.
Thank you so much. And Chris is going to pull up the presentation, which will provide an update for you on our COVID-19 response and other issues. I am not seeing full screen yet. There it goes. Thank you so much. Okay, so as usual, our response to COVID, similar to response to other initiatives, is designed to protect the health of our residents. And so tonight's update follows. But first, let's talk a little bit about this healthiest county in the state of Illinois. Again, since the Robert Wood Johnson began their county health rankings in 2011, DuPage County has landed in the top at least 5 every single year, except for 2013, I'm seeing. And then we were top 6 for health outcomes. Health outcomes include measures of length of life, in which we measure premature death, defined as years of productive life lost before the age of 75. It also, though, encompasses quality of life, which is garnered from and measured from self-reported health status, as well as the percentage of low birth weight newborns. When we talk about health factors, there's actually 4 different categories. Those are what we refer to as risk and protective factors. So the first category is health behaviors. How many residents smoke? What patterns of diet and exercise do we maintain as a community? What are our patterns of substance use and abuse, as well as sexual activity? The next category is clinical care, and we look at both access to care. So how many doctors, dentists, mental health professionals are exist within the county per capita, as well as the quality of that care. And then the two other categories, which I think are really pivotal in our maintaining and retaining the status that we have achieved, are around social and economic factors. So those include things like education, employment, family social support, as well as community safety. Again, we see this theme of health is more than simply access to quality health care. It encompasses both individual behaviors as well as community level norms and expectation. And then finally, physical environment is an element. We know that our air and water quality, as well as housing and transportation, all lead to either support or create barriers for our residents. So congratulations to all of us, but also all of our partners in education, in employment, in criminal justice, and beyond. So let's now move into some exciting updates that we have in reference or in regards to our COVID-19 response. So one of the strategies for addressing clinical care and making sure that people have access to both quality care as well as convenient access is one of the strategies that we have actually embarked upon with our COVID response. First, which is this mobile van, which we anticipate using first for our COVID response, and then leveraging the investment through the use of this mobile clinical unit for a variety of other factors. Clearly, poverty and need in DuPage County is dispersed and not concentrated like in a more urban setting. So we actually received your approval for ordering this vehicle last summer, fall, and we are now eagerly anticipating receiving it fully loaded at the end of April. Our own DuPage County Health Department graphic artist designed the wrap. It's actually a wrap. It's not painted on this vehicle. And if we go to the next slide, we see that there's actually each side of this vehicle represents a different age group. So there's an older, which is on the bottom left of the slide, an older kind of demographic, younger adults at the top, and then kids in the back. You see that this Sprinter van will be used to provide greater access to care for low-income and vulnerable populations for things such as childhood immunizations, outreach for targeted education and testing with sexually transmitted diseases, HIV testing, as well as our WIC supplemental nutrition program. So we anticipate the arrival of the unit again within a couple of weeks. Now you ask, where will we keep this unit? And that leads us to our next slide. So the other priority that we identified was that not only did we need a garage, but we also have been relying upon storage provided to us through our contract with the fairgrounds since the start of this pandemic. And we acknowledged that we needed to have more capacity to do that moving forward. So groundbreaking began actually after the start of this calendar year, when the ground was still fairly diggable, for this 60 by 50 vehicle garage and storage unit. It is where this new Sprinter van will be located and stored, as well as our Smile Squad, which is a larger unit. And both of those vehicles require an environmentally enclosed space that is both heat and cold controlled, climate controlled. It will also help with storage of personal protective equipment. And we anticipate that this rendering, actually, it looks like the top picture now. And by August, when you come, we may have you come in through the back door so that you can see the what will be then very close to being finished garage in the back. It is located on the southwest side of our property, kind of built into the berm that was created with landscaping and ground removal from the building of the community center. So speaking of our response, how are we doing with that? Which leads us to the next slide. We see that in spite of some of the comments from our public comments tonight, we see that although we've made tremendous progress and that almost 47% of individuals over the age of 18 have received at least one dose, and that 21% or 197,450 residents are now fully vaccinated, we still have a long way to go to achieving the full vaccination of 80% of our population over the age of 18. Next slide, please. And we also see that we continue, although our vaccine amounts have gone up, we are still receiving on average about 20,000 first doses per week. So if you divide 20,000 into the remaining hundreds of thousands of vaccines that are still waiting, people waiting to be vaccinated, we have a ways to go. Interestingly and concerningly, on the next slide, and before I start talking through this slide, I want to just make the clarification that absolutely, as of next Monday, DuPage County, with the rest of the state of Illinois, will be moving into the eligibility that allows for anyone interested who's actually 16 years old and over will be eligible to receive a vaccine. That does not, however, equate to everyone who wants a vaccine will be getting a vaccine next week. And that's concerning because what we see and what's really resulted in kind of our revamp of our meeting structure this evening is that in spite of our vaccination efforts, we're seeing increases and rather dramatic increases in all age groups of individuals 15 and over. Most dramatically in the 20 to 39-year-old group, which has experienced a 72% increase. Additionally, similar and concerning to us, similar to previous peaks in infection and disease activity in our community, we're also seeing increases in severe outcomes from the spread of the virus, requiring hospitalizations. In fact, today, 2 of the 6 hospitals in DuPage County identified themselves as being at peak capacity to take COVID-19 cases. We're also seeing this increase in activity impacting, on the next slide, our testing site. As a reminder, we continue to contract for the testing site at the Odeum Expo Center in Villa Park, and we're seeing, and this is the testing since the end of November, but what we're seeing very recently again is an increase in individuals seeking testing because of the increased activity. When we look at our vaccine distribution on the next slide, and we look at our week-to-week increase, we see that Although 536,952 doses have been administered, still only 197,000 individuals are fully vaccinated. Now, our doses, increased by 72,000, a little over 72,000 last week. And our percent of the population being fully immunized went up 3.1%. You'll see once again on the right side of the screen that our 7-day rolling average continues to increase, commensurate with our ability to access more vaccine doses for our community, which then translates in part to the fact on the next slide that DuPage County continues to lead the collar counties in the total population being fully vaccinated. And I want to take a minute to acknowledge that, again, on this slide reflects, and this information reflects DuPage County residents, regardless of where they received their vaccine. So it doesn't reflect the doses that have been administered within DuPage County to our residents. That said, we know that DuPage County residents are accessing other opportunities across the state. And similarly, we see individuals from outside of DuPage County accessing our sites and vaccines being provided here in DuPage. So the next slide breaks down once again. This is actually information about individuals who are receiving the vaccine from DuPage-based vaccine providers. And we see some trends continuing. First, and concerningly, we see incomplete data regarding race and ethnicity, which seriously impacts our ability to even assess, let alone target our efforts to reach underserved communities. We also see that consistently, roughly 45% of the doses that are administered in DuPage are delivered to out-of-county residents. And finally, we see that females continue to lead their male counterparts in receiving the vaccination. So we're continuing to work with IDPH in providing feedback and requesting that this information be prioritized as becoming, particularly the race and ethnicity information, becoming more robust and more accurately maintained. The next slide, though, shows a clear picture of a successful effort. So as of April 8th, for the population over 65 who experienced, once again, why they're in this high priority category is because they experienced the highest morbidity and mortality of disease over this last year. Residents over age 65 to date, 82.9% of those individuals have received at least one dose, and 62% nearly are fully vaccinated. But even with that, when we look at the total number of residents over the age of 65, there's still about 24,500 residents in this high-risk category who may still be on our list waiting for the vaccine. The next slide really shows what President Tornatore identified, in that we are only slightly behind Kendall County in achieving this feat. And we are very pleased, yet not satisfied with the progress that we're making. So as we go to the next slide, let's talk a little bit about statewide reopening metrics. And certainly with the increase in case activity that we're seeing, as well as the severity of those cases, we're not quite as hopeful as we were perhaps even last month. However, we know that there are two primary areas of metrics that the governor has identified for this bridge phase that would move us toward reopening our communities in a much more substantial way. One of those has to do with vaccine of our 65 and up. And we see that we are actually meeting that metric. In the state of Illinois, now there are 73.5% of all individuals over the age of 65 who have been vaccinated. But the other set of metrics is around our health system capacity. And when we look at those, we see that on the far left, we see that the available and staffed ICU beds remaining over 20% is really the only area of positive news as we look across these other metrics. So we see the next graph talks about or demonstrates the new hospital admissions for COVID-19 like illness. We see a very clear and concerning increase in that. We also see on the next graph there, the number of hospitalized patients with COVID. So what that tells us, since that's going up too, is that people who are being admitted are actually staying for a few days. And so we're adding to that, the numbers of hospitalized patients at the same time. Finally, although the COVID daily mortality is in green, and it indicates that there's been no change week to week, unfortunately, last week, we saw an actual reduction in mortality. And what we know about this based upon our last 2 or 3 surges of disease or waves of disease is that typically when we see hospitalizations going up, then it takes us a few weeks to realize the devastating and most severe outcome, and that is death. So when we look at vaccine, because this really is a race right now that we're embarked upon, it's us with vaccine against the virus. We see that we have kind of plateaued once again. We are on a pretty decent increase. Of course, that decent increase is only represented because we had that real terrible week when we only had 2,000 doses coming to us. Again, the next couple of weeks are projections only, but we're very concerned when we look at that week of April 18th, when we go back down to 10,000 doses. We are not seeing the tsunami of vaccine on the horizon, but we do know that some counties downstate have seen significant declines in demand for vaccine. That may and could result in that vaccine, instead of going to them, being reallocated to other places in the state. And so we hold out hope that we will be able to increase the number of doses that we receive. Because on the next slide, as you recall, on a weekly basis, we are able, through our partnerships, if we only had access to those doses, to be able to push out nearly 66,000 doses a week. Now, the state of Illinois on the next slide has begun providing the weekly allocations. If you were like me, I kept hearing last week that we were going to have a 1 million dose week this week. And so I was slightly surprised, no, not slightly, very surprised when this weekly allocation came out and indicated only about a 40,000 dose increase. However, the state of Illinois was actually incorporating in their 1 million dose estimate the federal allocation. So the increase to the state through our, that's under our direction and accessible to us, was not nearly as dramatic or substantial as we had hoped. The next slide, again, is just a reminder that on our website, you can track where the doses are going on a week-to-week basis. And then the next couple of slides, let's click through because we've covered those. And let's stop and talk for a few minutes about our registration and community vaccination clinic update. Again, we have been able to garner additional vaccine from the state because of a unique, we are the only mass vaccination site in the state of Illinois, which is entirely under local control and staffing. We have been able to expand, however, our hours of operation, and now are operating Mondays through Saturdays. And we're also grateful for the additional doses coming to this site so that we can free up some of the vaccine to be distributed across our network of community providers. Hopefully you can read, but in case not, as of yesterday, we still, however, had over 200,000 total registrations in our system, individuals who are waiting for the vaccine. We still have 12,000 individuals or about roughly 6% who are in that 1A category, those individuals who are healthcare professionals. And then we have about 32%, roughly a third, right? In the 1B, 1B plus, and then all other remaining groups. That's roughly 65,000 individuals waiting for vaccine in those other groups. Again, contrast that to the 20,000 or fewer doses that we're receiving on a weekly basis. And you see that the demand for vaccine continues to outstrip our supply. Additionally, we're not seeing a real slowing as other places in the state are, because we have over 3,000 new registrations per day on our website over the last 14 days. The other primary role that we have been playing is one that is considered an essential public health capacity, and that's disease control measures. So as a reminder, the goal of public health surveillance, and that is outlined here, is the reduction of morbidity and mortality through the control or prevention of disease. And public health surveillance really begins with that case investigation and contact tracing. Case investigation and contact tracing is required to be done by us as a certified health department through the Illinois Administrative Code. It is also highly recommended by the Centers for Disease Control and Prevention, as well as IDPH, and it is aligned as a public health standard of care and best practice. It involves investigating, educating, supporting, and self-isolating infectious COVID cases, which is then followed by contact tracing, quarantine, and testing recommendations for close contacts. And that it's very important to remember that the purpose behind all of that is to interrupt disease transmission. The next slide really shows through a graphic depiction that if we were to stop investigating cases, it would actually lead to increased spread because the cases would not be informed to isolate. They would get their positive test results, but they would not have that phone call by one of our staff to educate them on what happens next. That would result in a cascading effect of increased cases not being investigated to elicit close contacts for then subsequent timely contact tracing and actually leading to further spread and severe outcomes. The other very important, especially as we're talking about the variants, and particularly we believe that these variants are contributing to this increase in cases, is that the more infection that exists in a community, the more opportunities that the virus has to replicate itself, which means that then because a virus needs to replicate itself in order to develop more mutations, which leads to variants, which leads to more transmission, and ultimately then to the preventable cases, hospitalizations, and deaths. So that's why we do case investigation and contact tracing, but let's look at the next slide and see how well we do it. As we have mentioned previously, the state of Illinois had awarded us a significant amount of funding, which escapes me at this moment, but we can come back to if people are interested, to build up our case investigation and contact tracing workforce. From just this January through March, we have received reports of nearly 20,000 cases. And out of those, our team has completed over 15,000 case investigations. This is important because of the close contacts identified through these investigations, over 10% of the individuals were found to have contracted COVID who would not have otherwise been detected without the outreach by our team. We actually have outperformed the state, and has been indicated to us in several phone calls that we have one of the top performing case investigation and contact tracing programs in the state. The bottom line is allocating and prioritizing funding and staffing resources to conduct necessary case and contact investigation is an essential public health practice to reduce COVID-19 related disease and deaths. Alongside, and we have to continue it, alongside our efforts to vaccinate as many people as possible, while we continue to promote mitigation measures to what we've heard even this evening, an increasingly complacent and fatigued community. So let's look to some light and positivity for as I complete this presentation. We and you hear so many complaints about COVID-19, our response to COVID-19, that we wanted to share some of the positive feedback that we've received. So I've highlighted some of the quotes on the presentation this evening, but Penny will also be sending you an electronic, a more complete version of this, of these positive feedbacks that we've received primarily as a result of our testing effort. And the photo, thanks Adam for taking it, is of actually what we have up at the mass vaccination site. It's a kudos board so that everybody coming in, nearly 100 people a day who come in to staff that clinic, are reminded of the important work that we do and that they're doing on a daily basis. Yesterday, we had the opportunity to take Congressman Caston and some of our county elected officials for a tour of an overview of our community vaccination site. And one of the contracted security guards who's been with us since we actually opened the testing site commented on how marvelous it is to have had both of the opportunities. He was commenting that at the testing site, people weren't very happy. They probably had learned that they had been exposed to the disease, and some of them really weren't feeling very well. And he said, contrast that to working at this mass vaccination site when people are joyful. They want to almost give us hugs because they're finally able to see the people that they love, to maybe interact with their grandchildren for the first time again. And he was just very, very impressed with how far we've come in a year's time. But it's not only our work at that site that's important. We've also been working on an ongoing basis. And the next slide really reflects the feedback from one of our critical infrastructures in DuPage County, who we were able to work with. We helped them, assisted them, and supplied them with vaccine. They have on-site medical staff. So we provided them with not only the vaccine, but also a town hall to provide education to their employees on the importance of getting the vaccine. And I think it's important to note that we'll be doing a similar kind of town hall webinar with our very own Dr. Chug and then Dr. Kevin Most from CDH Northwestern CDH next week to really address some of the vaccine confidence issues throughout the county and the health department's staffing. So with that, I'd be happy to open to questions.
Thank you, Karen. Are we going to get back to the screen with everyone? Hold on, we're going to try to see everybody back on the screen. There we go. Okay. Thank you, Karen. Does anyone have any questions of Karen? Any member of the board? Comments?
Sam, this is Lanny. I have a quick question. I was really in high hopes that this partnership with the IDPH would increase our numbers of vaccines. I'm not too impressed by the increase. In fact, we have a decrease rather than an increase. What's the problem there? Do you know?
Well, again, those are projections where we see the decrease. And what we have seen pretty consistently is that's the base. And typically we see a higher number of doses than what has been projected. We continue to advocate on behalf of the residents of DuPage County. I think you all probably saw, just like I did in the Tribune this last weekend, about, it was almost a lighthearted kind of article about how Adams County has now become a tourist destination for people from the Chicagoland area who can't get a vaccine in the Chicagoland area and so have to travel there. And so we've been very vocal in advocating on behalf of, it's not that we have anything against Quincy and we think it's a beautiful river town. However, we also think that all residents in the state of Illinois should have equitable access to the vaccine and not have to drive, even if they can, not have to drive across the state in order to access this life-saving vaccine.
Thank you, Karen.
Mm-hmm.
Any other questions or comments?
Yeah, this is Dr. Scouten. Karen, I have a comment and a question. So the comment, I still see many patients every day, and many have gotten their vaccines, through the county. And I have to say they marvel at how smooth the process, how wonderful it is. It's just heartening to hear what a great job you and your staff are doing in administering the vaccines. The question I have is, there are some folks who have bad allergies, they carry EpiPens, and the guidelines have been that they should get their vaccinations in a hospital setting. Are we able to direct our patients who need to go through the county to get to a hospital for their vaccines?
That's a great question, and thank you for that comment. And I will let Andrea and Dr. Chug address the other question.
I can start.
If you want me to. Oh, go ahead.
Okay, I'll start. Just that certainly we are equipped, and I think Andrea will speak to this more specifically, to address any range of allergic reactions, including a severe allergic reaction, we do maintain emergency epinephrine on site. And then we happen to be very closely located to Central DuPage Hospital. So Andrea, if you'd like to speak to how that's been implemented, if there have been, or when there have been some allergic reactions on site.
Yeah, and we do screen everyone as they come in. And if anybody does screen positive of having a severe or anaphylactic reaction to something, we do offer and say that we can help them, get to a setting either in a doctor's office and or the hospital. And most people so far have wanted, there's been a couple people that have taken us up on that and said, yeah, I would prefer, or they've canceled their appointments and said that they've made the decision to go and get it at a hospital setting. But the people on the boots on the ground, we do have all the vaccinators in a day, which is usually around between 20 and 24 are all nurses. And then we have special first aid nurses that there's between 3 and 4 first aid nurses that are in the observation area, literally like walking up and down every aisle of chairs to make sure people are feeling okay. And anybody who has had a history, even of severe allergies, not even anaphylaxis, we have them sit in the front row for the 30-minute observation. We do have EpiPens available. We also have special first aid stations kind of away from everything. Thank goodness to date, we've only had to administer an EpiPen once. And actually, to be honest, it was somebody who had had COPD and had other breathing issues, and we weren't 100% convinced. She definitely wanted, she carried her own actually, and she wanted it, and we did send her to the hospital. We called 911, and she did spend a couple hours at the hospital, but was released without issues. So knock on wood, at this point, we haven't had any concerns, but we do not only screen them when they come in, but then the vaccinator also goes through those options with them, and to make sure that they feel comfortable. And then we do a warm handoff from the vaccinator to the first aid station and let the observation area, and say, this person has a history of it. And we spend a lot of time one-on-one with those people when they're there.
That's great. Thank you so much.
This is Jan Geider. I know there are some physicians out of Northwestern CDH who are actually arranging for patients that they feel may be at greater risk to have their vaccines done in the hospital setting. Is that something they're doing then, on taking their own initiative to do? I mean, I just assumed there was some guidance from the county health department.
From my understanding, and somebody can correct me if I'm wrong, I know that a lot of our health system partners have used their MyChart or went through like their EMR to see, and if people are high risk, they have tried to reach out to those folks first and have them come in and do it that way. In addition to, with the CDC guidance, not even like health department, but the CDC guidance for, for those that have a history of anaphylaxis, we are, having them check with their doctors. If there are any questions that come in from clients about that, we are referring them back to their physician to see what their recommendations are, because they know their patients better. But yeah, a lot of them have reached out, and they've shared with that on our hospital calls that they have reached out to those higher risk folks and gotten them into a hospital vaccine clinic.
And can somebody, we can't get to the chat right now. I saw Lori had a question.
I figured out,
Okay, cool.
I hit something on my microphone. My question is, why is the state rushing eligibility for additional groups such as those over 16 when we don't have enough doses to properly vaccinate those already eligible?
So I know the answer that we hear. So the answer that we hear is that there are parts of the state, we're a big state, we're in this together. There are parts of the state who have actually started vaccinating these other populations. So that's the message that we hear back.
If I might share, I did look into that, and one of the reasons they were lowering the age is because in some of your ethnic groups, like African Americans and Latin Americans, they tend to die younger from COVID, and they tend to have serious disease more so than other populations. So this was a way of getting vaccines to those populations that are most affected and at earlier ages.
Thanks.
We also have had the opportunity to begin a couple of pilots. So thanks to Adam and Andrea are really the two who are leading our mass vaccination efforts, or vaccination efforts, I should say. And certainly we had heard about the need to vaccinate people in congregate settings. Now those include congregate settings like nursing homes, those include congregate settings like our Scylla apartments, but those also include congregate settings like jail. And this week we were able to supply the jail staff, and Andrea, correct me if I'm wrong, but with enough doses to fully immunize every inmate currently who was interested in receiving a vaccine, or almost everybody. Is that right?
Yeah, there was 150 or 152 that wanted the vaccine, and they administered 120. So yeah, just shy of everybody that wanted it, and have plans to finish them next week.
Great, great. And Adam, you want to provide us just kind of with a roundup of the numbers, and then today we may have a fireworks show after this meeting because we achieved a great milestone. So Adam?
Yeah, can you hear me?
Yes.
Okay. I actually did want to, just before the numbers, I wanted to mention in response to Lori Bottom's comment, you know, one of the nice things about our system and what we're doing now is, even though that eligibility is opening up to everybody, our system is able to target the appointments and offer those scheduling opportunities to the higher risk groups, to the prior categories in the order that people signed up. And we're able to keep doing that and making sure that those folks are prioritized. So I know there's some concern and legitimate concern of people, you know, maybe who are 1B plus that have been waiting patiently, and then suddenly everybody's eligible, going to steal my spot in line. I can say, at least at our site, but that won't be the case because our system is allowing us that control to target those appointments.
That's excellent.
So
Thanks,
I did
Adam.
just want to offer that. Sure. And then, yeah, Karen, to your point, so our total so far today, through today, we've done at DCHD, so it's 47,690 total vaccinations at the DCHD site. And yeah, to Karen's point, we did break a milestone today that we were really excited about, doing over 1,500 doses in a single day. And we did 1,527 today. So that was our single day high. And it's really a team effort. I would give most credit to Andrea, her vision for how the site operates, and the fact that we can keep squeezing out that efficiency is a lot of her hard work and a lot of the hard work of the team that we get to work with every day on that. So we're excited about the progress being made there. Absolutely. Still a long way to go, but we're ramping up each day.
Okay, anything else? Any other questions or comments regarding what Karen or anybody else had to offer? Okay, hearing none, seeing none. Thank you, Karen. I'm sure I speak for the entire board when we thank you and all of the people over at not only the mass vaccination site or a community vaccination site, but everywhere else to continue to get our citizens vaccinated in a fair and equitable manner. Moving on to approval of the minutes. I will entertain a motion to approve the minutes of March 11th, 2021.
So moved, Weeks.
Motion seconded by Member Garcia. Any questions, comments, corrections to the minutes? Hearing none, seeing none, roll call, please.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Garcia,
Aye.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore.
Aye.
Mr. President, the motion passes.
Thank you. The minutes are approved. Moving on to the treasurer's report. Mike, I will turn that over to you, please.
Thank you, President Tornatore. As of February 1st, the Health Department General Fund balance totaled $26,964,803.10. Receipts for the month totaled $4,705,167.99, and disbursements totaled $5,424,325.56, leaving a month-end total in the Health Department General Fund of $26,245,645.33. Combined balances in all four health department funds as of February 1st totaled $35,302,724.11. Combined receipts for the month totaled $4,706,237.69, and combined disbursements totaled $5,845,417.55, leaving the combined balances in all four health department funds as of February 28th at $34,163,544.21. Investment earnings recorded to the general ledger in the month of February for all four health department funds totaled $4,075.62. Including these earnings, the year-to-date combined investment earnings as of February 28th totaled $12,351.77. That concludes my report for this evening. Are there any questions?
Any questions of Mike by any members of the board? Hearing none, seeing none, I'll entertain a motion to approve the treasurer's report as submitted.
So
Someone?
moved. Weeks.
Second,
Motion by Dr. Weeks, second by Mr. Spadoni. Roll call, please.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Garcia,
Aye.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
yes.
President Tornatore.
Aye.
Mr. President, the motion passes.
Thank you. And the treasurer's report is approved. Moving on to consent items, I'll entertain a motion to approve item 7.1, personnel transactions as submitted in your board packet.
So move, Guider.
Motion by member Geider. Is there a second?
Second Garcia.
Second by member Garcia. Any questions, comments on this matter?
I just
Hearing
had
none.
I just had a quick question. I'm just looking at the salaries for the people that are working temporary in the as the max workers. And some are paid $25 an hour and some are 35. Why this discrepancy?
Go ahead, Adam.
Sure. Yeah. The nurses are paid at a higher rate.
Oh,
The
okay.
nurses were harder to recruit and are doing a more complex job, so they're getting a higher rate.
Okay, that's what I thought,
Yep.
but I just want to make sure. Thanks.
Sure.
Any other comments or questions on that? Okay, there's a motion and a second. Roll call, please.
Ms. Geider,
Wait a minute. Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore,
Aye.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch.
Yes.
Mr. President, the motion passes.
Thank you. Moving on to item 8, action items. I'll entertain a motion to approve item 8.1, the transfer of funds for $28,000 as indicated in your board packet.
So moved. Weeks.
Motion by Dr. Weeks. There a second?
Second by
Second
Spadoni.
by Mr. Spadoni. Any questions, comments? Hearing and seeing none. Roll call, please, Penny.
Dr. Weeks,
Aye.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Garcia,
Aye.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munir,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatore.
Aye.
Mr. President, the motion passes.
Thank you. Moving on to item 8.2, I'll entertain a motion to approve an Illinois Department of Public Health, Illinois Tobacco Free Communities Program grant in the amount of $253,353.
Move Garcia.
Second, Finch.
By member Garcia, second by member Finch. Any questions? Hearing none, seeing none, roll call, please, Penny.
Ms. Garcia? Ms. Garcia?
Aye.
Ms. Geider?
Aye.
Dr. Hussein?
Yes.
Dr. Munir?
Yes.
Dr. Scouten?
Yes.
Mr. Spadoni?
Yes.
President Tornatore?
Aye.
Dr. Weeks?
Aye.
Dr. Wilson?
Yes.
Ms. Bottoms?
Yes.
Ms. Finch?
Yes.
Mr. President, the motion passes.
Thank you. Moving on to item 8.3, I will entertain a motion to combine items 8.3A, B, C, and D, unless there are any questions or objections.
So moved, Wilson.
Motion to combine by Dr. Wilson. Is there a second?
Second, Finch.
Second by member Finch. Any questions or comments on the motion to combine? Hearing none, seeing none, roll call, please.
Dr. Wilson?
Yes.
Ms. Bottoms?
Yes.
Ms. Finch?
Yes.
Ms. Garcia?
Aye.
Ms. Geider?
Aye.
Dr. Hussein?
Yes.
Dr. Munir?
Yes.
Dr. Scouten?
Yes.
Mr. Spadoni?
Yes.
President Tornatore?
Aye.
Dr. Weeks?
Aye.
Mr. President, the motion passes.
Thank you. The items are combined. I'll entertain a motion to approve items 3A, B, C, and D as combined.
So moved, Guider.
Motion by member Snyder, seconded by, who was that? I'm sorry.
Garcia.
Seconded by member Garcia. Any questions, comments? Hearing none, seeing none, roll call, please.
Ms. Geider?
Aye.
Dr. Hussein?
Yes.
Dr. Munir?
Yes.
Dr. Scouten?
Yes.
Mr. Spadoni?
Yes.
President Tornatore?
Aye.
Dr. Weeks?
Aye.
Dr. Wilson?
Yes.
Ms. Bottoms?
Yes.
Ms. Finch?
Yes.
Ms. Garcia?
Aye.
Mr. President, the motion passes.
Thank you. Moving on to item 9, unfinished business. Is there any unfinished business before the board? Unfinished business. Hearing none, seeing none. Any new business by any member of the board that wishes to bring to the forefront? Hearing none, seeing none. I have one item I'd just like to take the pulse of the board on. We have approximately $11,000 in our DuPage Health Matters 501c3 fund, our charity that we set up, or the charitable organization that we set up last year. We received a $2,500 contribution from the company that manufactures the piece of equipment that allows the sub-zero temperature freezer to work. He was very happy to be able to do what he's done, what that company's done, and made a nice contribution to our 501c3. We were looking to do something with that. Obviously, we can't do too many things given COVID, and the CARES Act money and the funds that have come from Washington and the state have taken care of as many of the public needs as we can wrap our arms around for the past year. One of the things that I think is close to all of our hearts are our employees, how we want to thank them and continue to thank them. And we talked about it a little bit at our executive committee meeting. In past years, we've had employee appreciation dinners, given someone a little packet, a little award. We haven't been able to do that this year. So we thought that maybe we would use some of that money, maybe not all of it, for a luncheon of some kind for our employees. Get it catered, get it here for people who are staffed here at the health department, at our remote locations, to say thanks. Not much, but an opportunity to say thanks. Maybe do it over a few different days, have some of us who are board members participate at that luncheon, get a chance to say thanks in person, get a chance to meet some of our staff and the people who've worked so hard Karen indicated that we've got about 600 employees. If lunch were to cost $15 a piece, that's $9,000. That's well within the money that we have. We could presumably do this with money from the health department's treasury. However, as an elected official, as well as being a member of this board, I'm always concerned about the optics of using quote unquote taxpayer money for what may be considered a pat on the back for employees. But no one's going to criticize, I think, us using our donations that we've received in our 501c3 to say thanks to our employees. The executive committee thinks it's a good idea. I think we can help facilitate that. Being an Italian, I know a lot of great restaurants that can help take us through this. And I'm sure that all the rest of you do as well. We'll take anyone's suggestions. Does anyone have any objection to trying to put together and facilitate this thank you luncheon, if you will, for our employees? And we can get into the specifics and where we're going to do it and how we're going to do it and who's going to be there once we know we have everybody's approval, if you will. Or if anybody has any other comments or suggestions, I'm certainly open to those as well.
I just have I have a quick question.
Yes.
Because I don't remember. What was the organization's mission or vision statement? Did we have one?
That's a great question. We talked about that also at the executive committee, and the organization statement and vision was, for lack of a better word, health and welfare of the general public, et cetera, et cetera. We are going to make sure to take a look at the mission statement in the corporate articles to make sure that we're not afoul of that. I can't see any way that we would be, given that, and usually in articles of incorporation, there's a kind of a catch-all that says for a number of other good and things for the general public. But what we'll do is go through that, probably vet it through the state's attorney's office, make sure that we haven't done anything, and presuming that that's not going to be a problem. It won't be. I mean, if it is, and we're thinking that even remotely is, then we'll stay away from that and not go that route with through the 501c3. But great question, Mindy, is something that we did talk about, and we're going to look into it.
Would it be inappropriate to propose a luncheon at a time when we're in the middle of a pandemic and luncheons are not done?
I lost you. What was that?
Yeah, luncheons are not something that can be done in the middle of a pandemic, and so even if we're in the planning stages for something like that, we really don't know when we can do a luncheon, right?
Right. We would certainly abide by our own rules. Yes.
We're not talking about doing it tomorrow, because it's got to come somewhere down the road. But we need to think about whether or not it's something that we would want to do, because it may take some time and some planning over the next few months. And perhaps when the weather is nicer, there are places that we could do it outside.
Yep.
Which would even make it, certainly safer for our employees and us.
Exactly. That's what I was going to suggest. The other option is to just do something outdoors. And I think throughout the pandemic, especially those who are on the front line of public health, they may need a break. So if we could even plan something at the campground, set up a tent or something, and just have people come through and encourage those who are actually working, and give those who are working a chance to come out and let us say thank you. I mean, can we at least entertain something along those lines?
No reason we can't have lunch outside and make it a picnic. Yeah, but however we want to do this, yeah, we'll figure it out. But sure, that would be another way to do it. It's a way to say thank you to our employees.
And we can eat Italian food outdoors, right?
Janice, I eat Italian food anywhere, so it really doesn't matter whether I'm inside or outside. But yes, we can. And it doesn't have to be Italian food, although we all know that's the best food in the world. But
No, I think
So
we
does
should all,
anybody have any other thoughts about it? Yes, Laurie, I see your.
no, as a board, I think we should be very, very supportive of something like this to say thank you and recognize all the hard work of all the people there, for sure.
Anyone
I
else?
agree. I agree. It's a nice thing to do for everyone. It's been a very tough year for everyone, so I agree. But I could also am a little concerned with the optics. So I think we need to make sure that we do it in a very safe way. And I'm sure Karen will tell us when we can do it. So I have faith.
I would recommend maybe using a small business restaurant. So, we're also kind of giving back to
Absolutely.
yeah, that would benefit everybody then too, especially.
Absolutely. Anyone else? Okay, all right, so we have some direction. Karen will start working on it, and hopefully maybe during the course of the summer when the weather warms up and we're moving forward through the pandemic and getting some better results, so we can make it happen. Any other new business by anyone? From anyone? Hearing none, our next meeting will be May 13th. Given what we see as the state of how we're going, we're probably going to continue this format for May and June at least. Hopefully things will break and we'll be able to all get together like we had hoped to be able to do this month, but I think it makes some sense not only from a safety standpoint, but at least our IT people are going to know what we're doing and how we did it, and they worked very diligently to make this happen tonight, and I want to thank them as well. I'd be remiss if I didn't do that. So our next meeting being May 13th, it'll be in the same session. We have nothing under executive session, I assume, tonight. That concluding it, I will entertain a motion to adjourn.
So moved, Wilson.
Dr. Wilson makes the motion. A second.
Seconded.
Second by Mr. Spadoni. Roll call, please, Connie.
Dr. Wilson,
Yes.
Ms. Bottoms,
Yes.
Ms. Finch,
Yes.
Ms. Garcia,
Aye.
Ms. Geider,
Aye.
Dr. Hussein,
Yes.
Dr. Munier,
Yes.
Dr. Scouten,
Yes.
Mr. Spadoni,
Yes.
President Tornatori,
Yes, aye.
Dr. Weeks.
Aye.
Mr. President, the motion passes.
Thank you. We are adjourned. Thank you, everyone. Stay healthy,
Bye.
stay well. See you next month.
Bye, everyone.
Bye.
Bye-bye.
Bye, everyone. Good meeting.
Bye.